Good morning, ladies and gentlemen. First of all, let me introduce myself. My name is Wayan Berliani. I am from Mahasiswa Denpasar University, majoring in English Education Study Program, Faculty of Teacher Training and Education. Now, I am participate in PILMAPRES, which is stand for Pemilihan Mahasiswa Berprestasi held by LLDIKTI Wilayah 8. Today, I would like to present about my scientific paper which entitled Optimization, the Role of Health Education in Forming Quality of Young Generation Without Drug Abuse, especially Magic Mushroom. Before I'm going to my scientific paper, let's explain a little bit about the theme of this competition. As we know, the theme of this competition is Sustainable Development Goals. It is 17 global goals that organized by the United Nations. And one of the 17 global goals that is the quality of health, which is focusing on eliminate or decrease the higher level potential of people who are in HIV/AIDS disease, especially younger generation. As we know that HIV/AIDS always come from first people who in drug addiction, seeing by the 5 acts of addiction. Those 5 acts addiction are drugs, sex, money, violence, and virus. First, drug. Why the first is drug? Because people who are in drug addiction, especially in magic mushroom, they will always find a way to get the magic mushroom, even in any time or any places. Second, they will do a sexual thing. When they couldn't find the drug, they will always transfer themselves to do a sexual abuse and sell themselves to get money to buy the magic mushroom. Third is the money. Why the money is become more potential? Because without money, people who are in drug addiction, especially magic mushroom, couldn't get the magic mushroom. That will make people who are in drug addiction always find a way. And the fourth option that they will do a violence. This violence can harm lots of people near them, especially their family. So in these cases, the fourth thing they do, the last is virus. After they do a sexual abuse, they will have a virus. This virus including HIV/AIDS and hepatitis. As we know that magic mushroom is the type class 1 in narcotic. This magic mushroom may affect lots of people in younger generation because as the data from the Jakarta Post, we can know that people who are consuming the magic mushroom since from junior high school, this can affect lots of negative impact to the young generation. And the negative and very high effect of this magic mushroom is that they will having a high potential of hallucination, where they can do lots of things based on their hallucination that can harm themselves. And there is a way to prevent this kind of addiction. First is people who are not yet in drug addiction, especially in magic mushroom, can be prevented by doing a counseling through lots of generation, by inviting people who are in addiction so that they know the negative effect directly by seeing the people who are in magic mushroom addiction, so that they are not there to try those kind of thing. Second, to prevent people who are already in drug addiction, especially in magic mushroom, is by doing a supportive counseling, by checking every day how the increase of the education to them, to the people who are in drug addiction. So by seeing this kind of thing, when lots of people who are interact in HIV/AIDS makes that difficult to achieve the Sustainable Development Goals, especially in quality of health. So that means the role of health education is really important for especially for the younger generation, because when the younger generation receive the education especially on health, they will spread the education to lots of people near them, and we can decrease the level potential of people who in drug addiction, and this kind of thing can be prevented, and we can achieve the Sustainable Development Goals on 2030. That's all of my presentation. I apologize if I done any mistaken during the presentation, and the last but not least, I say thank you very much.